So we're going to start just with some general ideas to help you be successful in mastering pharmacology material. So NCLEX test questions have generic names of medications. You won't see Tylenol, but instead we'll see acetaminophen, not Advil, but ibuprofen. So start reviewing medications using generic names now if you aren't already doing so. Studying by classification, or sometimes you'll hear me say class or classes of medicines, can make that task of memorizing a little more easy to digest. So there are 11 commonly prescribed beta blocker medications, 10 common ACE inhibitors, 7 common ARBs, 6 common calcium channel blockers. If you were counting, that's 34 medications already. And that's not every single med for each classification. That's just the most commonly prescribed medications. Sounds like a lot, right? But if instead we turn that focus to reviewing the 4 classes of medications that I discussed, it sounds like something much more reasonable to accomplish, and it is something much more reasonable to accomplish. We will review this in more detail in just a moment. I'm going to leave you hanging for just a moment here. Prefixes and suffixes are often terrific clues to help guide us through our pharmacology learning. Learning common naming structures of medications will help you sort those individual medication names into those classifications that you will review. Thank you for sharing that, Strudy. Huge benefit. I appreciate that. The last thing I want to say when we're talking general, I encourage you to keep it simple. You're going to spend a lot of time, or already have spent a lot of time, learning the complexities and intricacies of things like pharmacokinetics and pharmacodynamics. That's essential when it's presented to you as part of your nursing school learning. But now, as you start to make that transition to preparing for NCLEX, keep it simple. My example to you, amoxicillin. Amoxicillin treats bacterial infections by inhibiting bacterial cell wall synthesis. That's what I need to know about the action of amoxicillin. Remember how many pages we review about action? I encourage you to keep it simple. Let's talk about some of these in a little bit more detail at this point. So, as already mentioned, study by class. Really encourage you to have that be a part of your pharmacology learning. Most of the time, medications from the same class have similar names, they have similar mechanisms of action, and similar adverse effects. Let's take ACE inhibitors as our first example. For naming, we will often say they are prils, P-R-I-L-S. One of the examples might be something like lisinopril. ACE inhibitors are used to lower blood pressure. Common adverse effects are a dry cough. I'm learning these things in chunks about ACE inhibitors. We have a catchy little phrase that we use sometimes with ACE inhibitors to help keep some of those things in mind. Give them an ace, they'll cough in your face. That helps me remember that adverse effect of dry cough. Beta blockers, LOLs, something like metoprolol is a great example. You've got it, Strudy. We're going to get to that one. I love that you know it. Beta blockers will lower blood pressure and heart rate. Common adverse effects are bradycardia then and bronchospasm. So keep going in this fashion. Take a class of medication and learn some very specific things that are for that class. And I encourage you, as you're reviewing the classes of medications, to make a chart. Charts are actually a pretty easy way to help consolidate information into easier to read chunks. I'm not ever going to say easy, but easier is what we're aiming for here as we talk about studying pharmacology. So when you're making a chart for pharmacology, consider these 5 columns that you see here: class, suffix, action, nursing consideration, and examples. So let's take a look at this chart that's on the screen here. And Strudy, I love that you are giving us a little leg up on this information here. So first things first, ACE inhibitors are on here again. You kind of see a common theme with some of these medications here. ACE inhibitors, we talked about namings, right? You see that suffix pril on there. I want you to put that in your column. Action. We said we're going to keep it simple, right? It lowers BP. Now, here's my favorite, and Strudy, I am so excited again that you have got this down. I want you to think about nursing considerations, and I want you to think ACE. Angioedema is a potential adverse effect. Cough is a potential adverse effect, and elevated potassium. So use that acronym ACE there as part of your remembering for those adverse effects here. The last part of my column, I again can put some examples of the naming structures of these medications. So you'll see that captopril is in here, enalapril is in here. Beta blockers, kind of that same idea. Class is beta blockers, names, those OLOLs or LOLs, however you like to phrase it. I've got my action, and again, I'm going to remind myself, beta blocker, BB, those nursing considerations are bronchospasm and bradycardia. So I'm putting it in a format that makes sense for me to try to learn it. The last one that's on here, proton pump inhibitors. For names, I might see something like Prazols. Their action is to inhibit gastric acid secretion. For my nursing considerations, I see adverse effects like GI upset, headaches, and dizziness. And a naming example might be something like pantoprazole. Keep building using this chart. Add your next class that you study and add to the additional columns as well. As an extra note, I really encourage you to consider using charts as a unique and sometimes informal way to study. So make a chart, something like this. Again, keep it simple. Put a few classes on there. Make it your lock screen picture on your phone for a few days, all right? I'm going to ask you to open up your webinar chat again. Tell me, how many times in a day do you access your phone? How many times in a day do you see that lock screen on your phone? Try to tell me in the chat. What do you think is a good estimate for yourself? Oh, Aspen says too many. We don't even have to give numbers here, do we? Danielle's at 1 billion, okay. Breyer says too many to count. Valerie a lot. Lauren too many. Can't count it, right? I'm there with you. This isn't like a shout out kind of moment. Catherine, I love that you have a number here. Over 100 times. That's a whole lot of lock screen that you're seeing, right? Thank you for calling that out. I'd encourage you to consider putting charts as your lock screen image. You're going to look at it multiple times a day. And this can be another way to learn that material in that chart. I always say one of two things is going to happen. You're going to see it a lot, or you're not going to want to see it, and maybe you just won't access your phone, right? One of those two things is likely to happen. After a few days, switch it out. Put a new chart up. Keep repeating that until you are confident that you know the information on that chart. Let's talk about what we've learned so far, and let's look together at an NCLEX style question. So I'm going to read the question to you, and I'm going to show you part of our technique for breaking those questions down. Prior to administering medications to clients on a cardiopulmonary unit, the nurse assesses each client to evaluate the effect of the prescribed medication. Which client is experiencing an expected outcome? And we're going to select all that apply. So the very first thing we do with Kaplan questions, or NCLEX style questions at Kaplan, is to break it down, just read the question, and identify the topic. So I'm going to pick this one apart, and I'm going to ask myself, what is the topic for this one? And I see in here that my topic is the expected effect or the expected outcome of prescribed medications. So let's take a moment to just pause. Let's make sure we really let those words sink in. If something is expected, we can say it's normal. When we're talking about medication, it's the therapeutic effect or the desired effect that we're looking for that medication. So when we move to looking at the answer choices, we're going to think, okay, what medication is this? What's the expected effect? And is the client experiencing it? So participate in the chat with me. I'm going to read it out and I'm going to ask you, is it expected? So the first one, a client prescribed losartan for hypertension has a BP of 118 over 76. Is this an expected effect for this medication? Strudy, you're here. Yeah, look at you've got all kinds of support. Gary, Nicolette, yes, and yes. Normal blood pressure for adults is 120 over 80 or below. Losartan is an angiotensin 2 receptor antagonist. This is a class of antihypertensives. It's doing exactly what I want it to do. Nicely done. Let's do it with the second one. Clients prescribed verapamil for angina. They have a heart rate of 54 beats per minute. Is this an expected effect? All right. Overwhelming, I see no's and I love it. So is 54 a normal heart rate? No, this is somebody who's bradycardic, and bradycardia is an adverse effect of this medication. It's a calcium channel blocker. It's an adverse effect. All right, so we're going to select one and we're going to eliminate two. Keep going with me. You're doing great. Client prescribed apixaban for deep vein thrombosis who reports hematuria. Is this an expected effect? You're doing great. I love it. Angela, Catherine, Breyer, Jonathan, fantastic work. No, hematuria is an adverse effect. This is an anticoagulant medication. Any abnormal bleeding from any body part needs to be reported to the healthcare provider. Good. Client prescribed spironolactone for right-sided heart failure who has less pedal edema. Is this an expected effect? Yeah, you guys are rocking this NCLEX style question. I am so excited for that. Yeah, less pedal edema is an expected effect. Spironolactone, a potassium-sparing diuretic. Nicely done. The client prescribed diltiazem for atrial fibrillation who has hypotension. Is this an expected effect? No, what stands out? Hypotension. That's not a normal finding. So this is not expected. It's an adverse effect. This is a calcium channel blocker. And again, we've got a low blood pressure. Good. All right, last one that we're going to take a look at here. A client prescribed warfarin for a pulmonary embolism with an INR of 2. Is this an expected effect? Okay, so I'm going to pause to celebrate, by the way, the fact that your lab values will be given to you on NCLEX. So I'll tell you right here and right now that for somebody taking warfarin, the expected INR is, oh, Michaela, bonus points for you. It is expected to be between 2 and 3. So this is a normal finding. Very well done. Our final piece of Kaplan review of NCLEX style questions is to do what I call a double check. Let's look at the answers that we selected. Did we select the medications that are producing their expected effect when we selected 1, 4, and 6? Yeah, you've got it. And we eliminated those answers that were adverse effects. Aspen, what a great tip to share. Partial credit on SATAs. Now I know I am celebrating that. And I did see a question about the answer choice for number 4, so I'm just going to touch on that briefly before we move forward. So we're looking for expected effects. If somebody's taking spironolactone and now they have less edema or less swelling, I'm going to say that medication is doing what I expect. I would expect to see that. So that's why we've selected 4. You guys did great with that. I'm so excited. Let's move to another study suggestion, mnemonics. Mnemonics are a great way to really help you when you are learning pharmacology. You can think about using the ones that we're going to talk about here. You can think about creating your own, whatever works best for you to remember and retain that information. Strudy, you're very welcome. So, the first one I want to share with you, mixing insulin. I want you to think to yourself, RN. First, you draw up the regular, then you draw up the NPH. Michaela, I really do too. Some people learned this as clear before cloudy, either way. But mixing insulin, I'm going to tuck into my mind RN, regular, then NPH, insulin. All right, what about this one? The four B's of beta blockers. What are things that come to mind with beta blockers? I want you to think about four B's: blood pressure, bradycardia, bronchospasm, and blood sugar. So let's break that apart a little bit. I expect the blood pressure to decrease or at least become a bit more normalized, right? That's its action. With that, I might see an adverse effect of bradycardia and an adverse effect of bronchospasm. Finally, blood sugar. Beta blockers can cause alterations in blood sugar, and more specifically, sometimes they mask those symptoms of hypoglycemia. So, those are those B's that I'm going to keep in mind. Great nursing knowledge, Jonathan. Great for that. Okay, let's talk about grapefruit juice, shall we? Did you know that grapefruit juice interacts with over 60 different medications? So I want you to use this mnemonic to simply remember the four most common classes or subclasses of those interactions. And think to yourself, ACLS. Some of us think about that with other things, but I want you to think about it with grapefruit juice. These are some classes that interact: anti-anxiety medications, calcium channel blockers, lipid lowering medications, and seizure medications. So I'm going to remember ACLS with that grapefruit juice. All right, last one. It's best to check your blood sugar often. I'm going to use the mnemonic best to remind myself of those classes that might interfere with blood glucose. Beta blockers, we've covered that a couple times now. Estrogen, steroids, and thiazides. I'm going to remember it's best to check my blood sugar often. So when it comes to mnemonics, maybe consider keeping a set of notes that's just mnemonics. Whatever you do with your notes, make sure that they fit your personal learning needs. Are you someone who would prefer an electronic doc and you're just going to add to it every time you see something that catches your eye? Great. Are you somebody who likes notebook and a pen and you want to be able to write that down? If it works for you, then do it. So let's keep moving. NCLEX style question. You did great with the last one. Keep participating with me in chat. I'm going to read it first. The nurse provides care for several clients. For which client will the nurse question the prescription of propanolol? So as I said, that very first thing we're going to do, look at the question and figure out the topic first. We are looking here to question the prescription of propanolol. So let's do a few things here. I want you to reflect on what we've learned so far. So first of all, propanolol. LOL is in there. So I want you to tell me in the chat, what class of medications is propanolol from? Yeah, you guys are rock stars. Beta blockers. Fantastic. What have you learned about beta blockers and adverse effects? Think to yourself, BB, right? Tell me what those two were. Mm-hmm. That's right. Bronchospasm is one. What's the other one? Yes, Claret. Bradycardia. Okay. You guys did great with that. I'm going to hang on to that while I look at clients. I know lots of you did already, but let's talk about how we would pick it apart step by step. Would I question an order of propanolol for my client diagnosed with type 1 diabetes? No, not necessarily. Some of you might have. What's one reason that I might consider hanging on to that answer choice for a moment? Michaela, you're at a maybe with me. Why might I consider hanging on to that one? What did we also say beta blockers can impact? Blood glucose. So I'll tell you, if I was reading this question, I would have paused on that one for just a moment. Yes, Lauren, it masks hypoglycemia. I'll tell you, if it was just me, I would have held on to it for a moment. The client diagnosed with peptic ulcer disease. Would the nurse question a propanolol prescription for that client? What do you think in the chat? No, you're right. I have no contraindications for that client. All right, let's eliminate that one. What about our third one here? Would you question the order? Pardon me for just a moment here. All right. Client with history of bronchial asthma. Lots of you wanted to question that one, right? And I think that you're absolutely right to consider that. Okay, you told me bradycardia and bronchospasm. All right, I'm thinking about it. Hang on to it. What about our client diagnosed with atrial tachycardia? Would the nurse question a propanolol order for that client? Michaela, exactly. I actually love that they're going to have it here, right? Tachycardia, we're going to work to bring that down. You guys did fantastic. So we really confidently eliminated numbers 2 and 4. Let's just, for the sake of discussion, say I need to make some decisions about 1 and 3. We thought maybe this medication could mask symptoms of hypoglycemia, and you're absolutely correct. But Jared, I love your thinking here. I'm more concerned with an airway problem. So I'm going to teach that type 1 diabetic client about signs and symptoms and what to report and all things like that. But really, I'm more concerned with that airway client. So we're going to say that number 3 is our credited answer. We did spend our time reviewing those practical study tips for pharmacology, and I would like to just end our session with some overall tips. These tips are really designed to help you in reducing anxiety and building your confidence because that's a big part of this journey. I do want you to recognize that these are mindful actions. They are not things that just happen, but they're steps that you can take to really focus on your success in this journey. So, first, I want you to start your study early and be consistent. NCLEX is not an exam to cram for. So, start now, wherever you are on your journey, and prepare a little on most days of the week. With that, I want you to also continue practicing NCLEX style questions. You guys were so good with those questions, but continue practicing them. Here at Kaplan, we have thousands of questions available to review as you're preparing for NCLEX. Seeing that variety of styles, of topics really does help boost your confidence. You'll know what to expect from that test on test day. Create a pharmacology study guide, and please be specific on all of your study guides. So, for example, on Monday, I'm going to watch the crucial content video on pharmacology. On Tuesday, I'm going to review 20 flashcards. On Wednesday, I'm going to select a class of medications to review. I'm going to look at the content review guide and the content library. On Thursday, I'm going to head to the Kaplan Q Bank and select 20 pharmacology questions to take, and then I'm going to remediate those carefully. Repeat that process. Remember, being specific, it's much more likely that you're going to follow your plan instead of just saying, I'm going to study for 2 hours on Monday. Sometimes then we sit down and we're like, oh gosh, what am I going to do? What should I do? It's all laid out for you. Then you've got that plan there. Also, I want you to make sure that you visualize yourself being successful. Tell yourself good things. Tell yourself positive things about test day. And remember that if you're following the recommendations that we're making throughout this presentation, you can calmly and confidently answer those pharmacology questions correctly on test day.